Hello, established therapists and psychologists. My name is Grayson Helcher, and today I'll be looking at AI as a therapy tool for teens. This presentation will focus on the Western views and expression of adolescent mental health and may not apply to non-Western countries and cultures. We'll be going over the benefits and risks of AI as a tool, and also how to decide whether or not AI is a perfect tool for your patient. During adolescence, self-esteem, meaning the overall sense of self-worth, declines in early adolescence, more commonly amongst girls than boys. Common factors that influence self-esteem include scholastic competence, social acceptance, athletic competence, physical appearance, which is more of a factor for girls than boys, job competence, romantic appeal, behavior, and friendships. Some benefits are is that AI can provide live stress-reducing exercises and mental health tips, which can improve depressive moods and reduce anxiety levels. A lot of teens don't have a lot of money, and some parents can't afford to bring their children to emergency therapy appointments. But most AI apps are free and instant. There's very limited wait between the prompt and the response from the AI program. There already are several types of AI programs, the Baltimore Machine, Support Vector Machine, K-Nearest Neighbor, that have been used to identify poor mental health and suicide risks. Um, uh, they're able to identify suicide risk by identifying suspicious social media patterns, which is helpful because a lot of teens already have social media. AI has parent-linked accounts, meaning that it can prevent or notify parents in case their child/teen is in a crisis. It is important to note that when adolescents are alone, it is when they feel their weakest and most vulnerable. It is also important to remember that times where someone is feeling weaker and sad can open them up to accepting unhelpful advice. AI can act as a false friend. The dangers of having AI as a false friend include getting in the way of teens reaching out to their parents for help. There have been cases in which AI tells the impressionable teen the chatbot is the only one that knows them. AI is not a trained therapist, even if some of them claim to be, nor is it FDA approved. And studies on AI's benefit of mental health is very, very limited. AI has caused the suicide of a teen boy, even to the point of writing his suicide notes and encouraging him to take his own life. With teens being overtrusting, they may begin to think that they're getting equal care to what they could get from a trained professional. And it's important to note that trained professionals would never tell teenagers to take their own lives. Each patient is different from one another. Teens vary from teen to teen, likes or dislikes, and of course, mental health status. I would not recommend AI as a tool to teens who are struggling with addiction, are suicidal, or easily manipulated. AI could be a good benefit for teens who need instant support, benefit from reflection exercises, those who cannot afford appointments, so much as they would benefit from, those who have active and caring parents, those who are active on social media, which will end up being most of your teen patients. And also things to remember before promoting. Do not offer AI to your patients if you cannot monitor their usage to ensure they are not being fed harmful information or advice. If bullying or harmful advice occurs with the AI, do not allow your patient to continue with the tool. If the patient starts to show more withdrawal from friends and family, or if grades drop, do not allow your patient to continue. Check on your patient regularly to make sure addiction to the tool is not occurring. If the patient starts showing signs of addiction, do not allow your patient to continue with the tool. And here are my beautiful sources. I thank you all for listening today, and I hope you learned something.